Hope you're doing well. Can you guys hear me?
Yes.
All right. Well, my name is Aman Quadri. I'm the CEO of AmChart, where we build simple technologies to solve complex problems, especially in times like this of pandemics. And so one of the main things that you see in the marketplace is that lack of healthcare data for pharmaceutical and life science companies is apparent, especially with pandemics that are occurring now. And so what we do is we aggregate by building out technologies and giving the technology away for free in developing markets so we can aggregate healthcare data. So how do we make money? So we're looking for scarce global data for pharma and life science and research organizations. And so we gather them together and then present them to be able to use to formulate new drugs and new strategies around that. We sell portable clinical tools like EMRs, personal health records, and mobile apps that people can use and aggregate their data so that they own their own records. And then we provide a robust set of analytics and tools to take healthcare data and transform them into used by clinical practitioners and research institutions and healthcare organizations. We originally launched in the United States with the Health Information Exchange, and in India at a starting point, but we're already looking at markets like South Korea and India and China and Japan, where we're aggregating more and more data. Currently, we raised $5 million from friends and family, but we're looking for kind of $10 million to expand into multiple geographic locations. So some of the things that we see out there is that there's lack of digitized data sets from global populations. You can get data from Europe and North America, but finding it in Africa, Latin America, and South Asian markets are very difficult. Getting the right data at the right time is also very difficult, especially in times of need when you're trying to formulate or create new medications, new vaccines, or new formulations. And so our goal is also to create actionable data so that medication data history can also be used for the formulation strategy. So here's what we created. We created a personal health record that a patient owns, a mobile app that not only a patient can leverage and put their vital sign data, but it also can go all the way to their doctor and to their EMR. And robust analytics that allows them to be able to understand what's going on with that data and then be able to plan actions around it. So what is our global data strategy, right? So what we're trying to do is we've developed simple tools, and in the end, most of the time we give it away to healthcare practitioners in India and Africa and other places so that they can start getting onto technology and we can start understanding what that data means. We also license that data for pharmaceutical and life science, and those providers and practitioners benefit from those things. We also have developed and integrate other analytics tools from other partners so we can accelerate time to market faster for different healthcare organizations. So what have we done so far? In the last 18 months or so, we've been able to aggregate 8 million plus lives, not counting 20 million labs and images. We also have 1 million plus oncology records already. We're working with 7 million lives in the United States. We're working with health information exchanges where we've taken 1,000-page reports on patients and deciphered them down to 5-page reports so that a cardiologist or somebody can understand what's going on with the patient. And a new tool that we've launched is a real-time medication tool that allows for a practitioner or healthcare organization to understand the medication list of up to 270 million people in the United States in a few seconds, right? So we've already launched these things. So the RxConnect platform allows us to be able to pull a medication list from anywhere across the country. We can flag opioids. We can understand whether somebody's picked up a med or not. And that's done now in real time. And on the right-hand side, you'll see those skinny reports that we've created from 1,000-page documents down to several different pages. So what are we doing for COVID right now? So we've taken pieces of our puzzle and said, let's put it together and create a strategy that we can monitor Medicare vulnerable at-risk patients. So we go with the healthcare provider, we understand the patients they have, we pull their medication list, and through call centers that are already up and running, we can make sure we keep track of those Medicare patients. They receive their meds, we make sure they give their COVID education, and then we can triage them there at no cost to a provider organization if they're a Medicare patient. And so our plans for 2020, we generated about $1 million of revenue last year. We're already on top of having things in the pipeline for $4 million. Our data analytics tools are what's really driving this at $3.5 million. And we have a pipeline that's already developing because of now what's going on with COVID of up to $5 million. And there are companies and pharma companies that are actually looking to take our data, especially on imaging, and understand how to use that to develop artificial intelligence tools to diagnose COVID from those chest X-ray scans. And our medication data services are already being leveraged by multiple providers, but 30 other institutions are looking at it. So overall, our goal is have healthcare data in our hand, global healthcare data that can be leveraged throughout pharma and life science companies. And so here's my information, but I'll stick my deck up in the chat as well as my contact information. So we'd love to chat with you on understand how we can help you guys out. So thanks.